Well, welcome. I see that people are joining. We're going to wait about probably a minute or so as people are entering into the Zoom room, and then we'll get started. Melissa, has everybody been let in?
Yep, just I'm letting them in as they're coming in.
Okay. Just give it another like 30 seconds and then we'll get started. Okay, it looks like people are getting connected to their audio. Looking good. Okay, I'm going to get us started. I see it's about 3 minutes after the hour, so hopefully that gave enough time for everybody to jump in. Well, good afternoon, and welcome to the first meeting of the Community Review Board for the OHSU Legacy Transaction Review. My name is Rhonda Zaycox. I'm an independent consultant who has this wonderful opportunity to facilitate this Community Review Board. Next slide, please. But let's begin with some logistics to ensure we have a solid communication foundation moving forward. I want to let everybody know that this is a public meeting, so it is being audio recorded. After this meeting, the recording will be uploaded to the Oregon Health Authority's website. Closed captioning is available. A transcriber is also attending this meeting who will produce a written transcript after the meeting. I request that you state your name before asking a question or making a comment and speaking as clearly as possible to ensure that we have an accurate transcription. Sometimes I forget to share my name or before I make a comment, and so I will send some reminders for us to do that. If you want to ask a question or make a comment, please use the raise hand or chat feature in Zoom. Please note that comments or questions typed into the chat feature will only be seen by the Oregon Health Authority staff members who are hosting this Zoom call. In other words, the chat feature cannot be used to share comments among the Community Review Board members or other guests attending the meeting. The Oregon Health Authority staff folks will be reviewing those comments and questions and will bring them forward as appropriate. Please keep your microphone on mute until it's your time to speak, just to reduce outside noises. Are there any questions about these meeting logistics that I went over? Okay. I'm going to move us to the next slide, please. Our primary objective today is to set the foundation for our Community Review Board process so that we can work together effectively. We'll start with introductions and then review our charge, guiding principles, members and OHA's roles and responsibilities. Next, we'll agree upon group agreements for our meetings, decision-making process, and whether to hold a public hearing. We will take a 5-minute stretch break about halfway through our meeting time today. Are there any questions about the agenda? And OHA staff, if I'm missing someone raising their hand, please let me know. Thank you.
Get away.
I'm sorry? Okay, I'm going to move us on to the next slide, please, to introductions. So let's take some time to get to know each other. First, I'm going to ask each community review board member to introduce themselves by answering these 4 prompts. Share your name, and if you would like, your pronouns, the town or city you live in, whether you are representing any group or just yourself, and what motivated you to apply to be a community review board member. I'm actually going to call out each community review board member's name in alphabetical order. Then after we do introductions with the members, I'm going to ask the Oregon Health Authority Healthcare Market Oversight staff members to introduce themselves. And then I will just give a little bit more introduction about myself. So let's start with introducing the community board members. And Howard Cohen, I'd appreciate if you would come off mic and introduce yourself.
Can you hear me?
Yes, we can.
Hi, and you can see me, I hope. I'm Howard Cohen. You can call me Howard. I'm a retired neonatologist who's practicing my specialty beginning in 1978, initially in Illinois, until we moved out to Oregon in 2005, basically. Started working here in 2005. I was in a private group, Northwest Newborn Specialists. It worked at 2 legacy facilities as well as 2 Providence facilities in Portland. The second legacy facility is Salmon Creek in Washington. I also, when I moved here to be the medical director at Salem NICU, and worked there initially with the Northwest Newborn Neonatologist, but then beginning in 2012 with the OHSU Neonatologist and Maternal Fetal Medicine Specialist. And so I know both organizations pretty well from working with the OHSU folks and having a relationship with the bigger organization as part of that work. I also have I live in Oregon City. I'm not representing any group. I have a long history of doing quality improvement work in my field and patient safety work in both my field individually and for larger organizations, including the Catholic health system that I worked at in Illinois, OSF, St. Francis, and in Salem. And I've held official positions in quality improvement, and I've also done national work in quality improvement and collaborative and working with professionals and families to do that work. And I have a good understanding of the work that was being done at Legacy. I was the medical director at Randall Children's Hospital NICU for the last part of my career after I left Salem. So I think I have good skill set to bring to this venue in order to kind of assess the transaction that's being proposed by OHSU and Legacy.
Thank you, Howard, for that introduction and kicking us off. Appreciate it. I'm now going to move to Jerry. I think Jerome is your official name, but I believe you like to go by Jerry. So hi, Jerry. I'd appreciate it if you would introduce yourself now.
Rhonda. I'm Jerry Dallness. I currently live in Westland, Oregon. I'm not representing any organization. the reason for applying to be on a community review board, a couple of one is to provide some input and experience that I've had in the healthcare arena, not recently, but in my past. Currently, just to let everyone know, I'm on the board council for the Clackamas County Community Health Center, where I act as the treasurer. My previous experience in healthcare goes back to research at the University of Minnesota in the Department of Surgery, attended the London School of Economics and the London School of Hygiene and Tropical Medicine, where I did some work with the National Health Service while I was over there. And then I came back to the States and I worked in the private sector in the health insurance industry, and then also did some work on policy development with the Minnesota Department of Health, some healthcare reform back in the 80s, and eventually moved out to Oregon from Minnesota. And so here I am, and I'm looking forward to being on this board, reviewing the application and applying the rules and the regulations that are applicable. Thanks.
Thank you, Jerry, for that introduction. Appreciate it. I would now invite Joanna Mott to introduce herself.
You know what, Rhonda, sorry, Joanna might have to miss the first part of the meeting. So we might get back to her later if she joins.
Thank you. If I don't see her, if and when she joins, will someone let me know, because I would like her to introduce herself when she's able to join?
Yes, absolutely.
Thank you. Okay, I would like to invite Joseph, I believe Joe, his preferred name, to introduce himself.
Yeah, hello, my name is Joe Schnabel. I use he, him pronouns. I live in downtown Portland. I am not representing any group today, and I applied to be on the board because I'm recently retired and I have a lot of time on my hands. But more importantly, I spent my career in healthcare in Oregon, so I know these two organizations quite well, although I've only worked for one of them at OHSU right after I graduated from pharmacy school for less than a year. So it was very early on and for a very short time. I spent most of my career working in Salem at Salem Hospital, both as a clinical pharmacist and the pharmacy director of pharmacy services in Salem. And the last 5 years before I retired, I spent in Portland working for the Oregon Board of Pharmacy as the executive director. And I feel like I have a stake in this transaction as a resident of Portland. I'm very interested in public health and the health and welfare of the general public. I feel like I can approach the task objectively and would want it to be consistent with statutes and rules. And I'm also interested in quality improvement, much as Howard Owen described. We actually worked together for a short time in Salem, and so we're quite familiar with each other and had some interactions on various committees and in practice. And I'm also interested very much in process improvement and standards for improving processes in healthcare.
Well, thank you, Joe, for sharing your introduction.
Thank you.
I now would like to invite Latoria to introduce herself.
Yes, hi, good afternoon. My name's Latoria Haskin, and I am in Southeast Portland. No group I'm representing. I've been in healthcare for over 25 years, in healthcare regulations and policies and all that good stuff. And so I'm always looking out for the community when it comes to things such as this, because healthcare, you know, there's so many things to look at. And so I always want to keep ones abreast of, you know, how they can understand the healthcare language. So when this community review board opportunity came, I thought it'd be a good opportunity for my business to pursue so that we could have a say or have a voice in how things are, making sure that things are done properly and following the policies. So appreciate it. Thank you.
Thank you, Latoria, for that introduction. I would like to invite Leslie for an introduction.
Good afternoon, everyone. I'm Leslie Foran. I use she, her pronouns. I live in unincorporated Washington County, which is Beaverton, but I have a Portland address. Not formally representing any group, but I have a background, both professional and personal, advocacy for older adults and people with disabilities, as well as caregivers. And so, with my experience in healthcare and nonprofits, this was of interest to me to make sure that we are looking at all of the populations that access healthcare, and that includes caregivers. I also sit on a board of a nonprofit called Ride Connection, which provides transportation services in the Tri-County area. And I know how critical transportation is to accessing healthcare and other social drivers of health. So I'm excited to be a part of this.
Thank you, Leslie, for that introduction. I believe that Joanna has been able to join us, and if so, Joanna, I'm inviting you to introduce yourself. On the slide here, we're asking folks to share their name and if they would like their pronouns, what town or city you live in, any group that you are representing, and why did you apply to be on the Community Review Board? Joanna, I'm not hearing you. If you are sharing your introduction, might be on mute. All right, well, we will loop back to Joanna at the end. I'm going to move us on now to inviting Teresa to do an introduction, please.
Hello, I'm Teresa Goodell. I've been a registered nurse for 42 years. My license is about to expire this month, so that'll be interesting. Um, I got my PhD in nursing in 2004 at OHSU, and I also practiced and taught there for 19 years. I had other roles in healthcare, including being a research scientist and taught at a few other institutions as well, both in here and Ohio, the state I used to live in. I've also been on a couple of healthcare boards that might bring some relevant experience. One for a hospice palliative care agency, and one for a two-hospital system in Ohio. I live outside of Beaverton in unincorporated Washington County. I'm not representing any organization in particular. And my main motivation for joining this group was because I'm concerned about the effects on accessibility and cost of healthcare consolidation. Thanks.
Thank you, Teresa, for that introduction. I'd like to invite Wendy Martin for an introduction.
Hi, my name is Wendy Martin. I'm also in Portland, and like a few folks who have mentioned already, the reason that I'm wanting to be on the Community Review Board, or that I applied, is related to access to care. So for the past 25 years, I've been both a patient of both systems, but also overseeing employee group health plans. And as you all know, a lot's changed over the last 25 years. And so further changes are of interest to me.
Thank you, Wendy, for that introduction. I'm just going to offer one last time for Joanna. Okay. All right. Lauren, maybe you can let me know if and when Joanna joins us again. Okay. I would now like to invite the Oregon Health Authority Healthcare Market Oversight staff members who are involved in this transaction to introduce themselves. Please share your name and, if you would like, your pronouns, your position and role on this transaction. And Lauren, how about if we start with you?
Yes. Hi, everyone. My name's Lauren Neely. I use she, her pronouns, and I am helping run the logistics for the community review board meetings, and I'm also a policy analyst with the Healthcare Market Oversight Program.
Thank you. Cassie, would you be willing to introduce yourself?
Hello, my name is Cassie Call. I am with the Oregon Health Authority and I am helping to support this community review board as well. I am a policy analyst with the team.
Thank you. Zachary, would you be willing to introduce yourself?
Sure, happy to. Hi, everyone. I'm Zachary Golden, he, him pronouns. I'm the healthcare cost economist on the healthcare market oversight team, and I'm leading this review for OHSU and Legacy.
Great, thank you. Is there any other staff member who would like to introduce themselves?
I think that's probably it from the OHA side for today.
Okay, great. So as for me, as I mentioned at the beginning of the hour, I'm Rhonda Zaycox. I use she, her pronouns. I am not an Oregon Health Authority staff member. Rather, I'm an independent consultant who runs a consulting group called Insight for Action. We're a small group that helps purpose-driven organizations strengthen their social impact through strategy and evaluation. My role on this community review board is to facilitate these meetings, to ensure that everyone has an opportunity to ask questions, to share comments, and collectively make a recommendation to the Oregon Health Authority about this transaction. Thank you, everyone, for sharing a little bit about yourself. I'd like to move on to the next slide, please. This is a recap of this amazing community review board. From your introductions and from getting to know you, some of you in earlier orientation calls, this is a powerhouse group. Folks who bring so much perspective, experience, and a commitment to this transaction. So we thank you so much for volunteering for this important opportunity and look forward to working with you, and just thank you for your service. Next slide, please. Just a recap of the three of us who will be the primary staff on this transaction. As I shared previously, it's my job to ensure that the meetings run smoothly. And to ensure productive meetings, at times, I may offer process suggestions or maybe move us on a little faster than would we like, just to ensure that we cover important aspects. I thank you in advance for your grace as we move through these meetings. Zachary, as he mentioned, he will be really leading the review of this transaction, and Lauren really will be carrying out a lot of logistics, and she would be the person that you will reach out for specific support or guidance in between meetings. Zachary is now going to provide an overview of the Healthcare Market Oversight Program. So if we can move to the slide. Thank you, Zachary.
This is Howard. I wonder, can I just add, I can't see a raised hand icon. I don't know if other people can see something. but I haven't been able to find it if I needed to. That's why I'm interrupting. Sorry.
No worries. Thank you for that. Can someone provide guidance to Howard about where to find the raised hand?
So at the bottom of the screen, you'll see an icon that's shaped like a heart and says react under it. And if you click on that, then it gives you a bunch of different options, one of which is raise hand. Great. That's a great question. Thank you, Howard. Okay, well, with that, thank you, Rhonda, for that great introduction. And again, thank you all, Community Review Board members, for
This
being
is
here.
Joe Schnabel. Sorry about
Joe,
that.
go ahead.
I'm raising my hand this way because my React icon only has two options. One says play chime for raise hands. The other one is recognize hand gestures. And it just puts a check mark next to them when you click on them. I don't think it actually puts a raise hand in my box.
There are two different things you can click on. You can either click on the little carrot to the right, don't do that, or click on the heart.
Oh, I see. Got it. There it is. Okay, thank you.
Sure.
Thanks.
I just love it that we're jumping in already and helping each other out. So I think that was you, Teresa. Thank you. I really love this group moving forward. So is everybody clear on how to hit the react to hit the button? And then when I hit the button, I see a bunch of icons and I can raise my hand. Is everybody seeing that? Anybody not? Awesome. Thank you. All right, Zachary, thank you.
Great. All right. Yeah, this is wonderful. This is great. So I'm going to chat a little bit about the Healthcare Market Oversight Program overall. Feel free to raise your hand if you have specific questions. We'll also have a few minutes after this section for additional questions. Let's go to the next slide, please, Melissa. So very broadly, through the Healthcare Market Oversight Program, the Oregon Health Authority reviews proposed healthcare business deals to make sure they support statewide goals related to cost, equity, access, and quality. You're going to hear a lot about those four, what we call domains: healthcare cost, health equity, access to healthcare, and healthcare quality. So those are four really important areas. Many of the business deals that we review relate to what's called consolidation, which is when different entities combine to create a larger entity that may have more market power. So you may hear some terms about consolidation, business reviews. So we'll get to more specifics soon. Let's go to the next slide, please. Just by way of some history. So back in 2021, the Oregon legislature passed House Bill 2362, after which the Oregon Health Authority developed some rules, some administrative rules for the program. And the Healthcare Market Oversight Program officially launched March 1st, 2022. So we're going on our 3-year anniversary coming up here. At the bottom of this slide are links to the statute language itself, as well as the Healthcare Market Oversight permanent rules. So the official administrative rules. These are really interesting. If you're so inclined to, at some point later, click on those and read those, if you'd like. Let's go to the next slide. So in terms of overall program goals, there are 3 really important aims for the Healthcare Market Oversight Program. The first is to promote transparency. And this is one in which the Oregon Health Authority publicly posts the notices as well as reports so that communities across Oregon can have the information about the planned transactions in their communities. So that transparency is a key component, as well as posting all public comments about a given transaction. Secondly, the program supports statewide priorities. So the Healthcare Market Oversight Program ensures that any kind of healthcare deal, business transaction, supports affordable care, eliminating inequities, improving quality, and improving access to services. And then thirdly here, the program monitors and studies impacts. So the Healthcare Market Oversight Program tracks these deals that happen in Oregon, and we're required to do follow-up reviews. So after the fact, after a given deal closes, we review those 1, 2, and 5 years after the fact. Additionally, the program produces reports on the impact of healthcare consolidation statewide. So we do those reports every 4 years. and next year will be the first time that we do that report. So those are the three important aims of the program. Let's go to the next slide. And I have some colleagues dropping links in the chat, so those might be helpful. Feel free to peruse those or just grab them for later, whatever's best for you. Let's chat a minute about the types of entities that are subject to review under the Healthcare Market Oversight Program. Broadly, the program reviews transactions that involve a healthcare entity. What is a healthcare entity? So think of entities that provide healthcare. Hospitals, a doctor's office, a dentist's office, a health plan, a health insurance company, or a medical group, like a group of physicians or other provider group. There's another type of entities, and that is those that help administer healthcare. So think pharmacy benefit manager or a management services organization. Thirdly, there are entities that maybe control a healthcare company, something like a corporation or a private equity firm. So these are just some examples. We actually have a link at the bottom of this slide with a more exhaustive list of entities that are subject to review, if you're interested. So those are the types of entities that are subject to review. Let's go to the next slide and talk about what types of transactions are subject to review. So there are two important questions that are asked in terms of when a transaction is subject to Healthcare Market Oversight Program review. The first is it material? Now that's an odd word, material, but in the legal sense here, what we mean here is if one entity has at least $25 million in annual revenue, and another entity in the business deal, in the proposed business deal, has at least $10 million in annual revenue, then it's considered material. So if you have two really small healthcare entities, let's say their average revenue is only 1 million or 2 million, they are not material and they would not be subject to review. But if the entities have this threshold of revenue, then there's a second question that's asked, and that is, what is the transaction itself? Is it a merger, an acquisition? Is it a corporate affiliation? If so, then yes, it would be subject to review. But there are other types of business deals, joint venture, things like that, that are only subject to review if they will eliminate or significantly reduce essential services, or if they will consolidate negotiating power, particularly for providers or insurers. So if either of those, if the answer to either of those questions is yes, then it's subject to review. But if the answer is no, then it is not subject to review under the program. So those are just some high level kind of summary here of what types of entities are under the HCMO review and what types of transactions are under HCMO or Healthcare Market Oversight Review. Let's go to the next slide and talk about the statutory authority of the program. So here, Oregon Health Authority has the authority to, after reviewing a proposed deal, either approve it, approve with conditions, or disapprove a proposed transaction. There's one important note here at the bottom that if a given transaction involves a domestic health insurer, like an insurance company, then technically the Oregon Health Authority provides a recommendation to the Oregon Department of Consumer Business Services, or DCBS. The Department of Consumer Business Services, they're the official insurance regulator. So in those cases, the Oregon Health Authority provides a recommendation to DCBS. But in other cases in which a transaction does not involve an insurer or a carrier, then the Oregon Health Authority itself has the authority to approve with conditions, or disapprove or reject a proposed transaction. Let's go to the next slide, please. Let's kind of rebase our conversation. Let's see, we lost. Let's go to yeah, there you go, thanks. Let's kind of regroup on the transaction we're here to think about and talk about. So what is the healthcare market oversight process specifically for the OHSU-Legacy transaction? So here, starting on the left, so OHSU and Legacy submitted a notice of proposed transaction. The Healthcare Market Oversight Program conducted a preliminary review. This lasted 30 days, after which it was moved to a comprehensive review, and that's where we are right now. The community review board and the process that you all are going to undertake here and the recommendation you will provide, that's part of that comprehensive review. And the way the statute is written, that comprehensive review can last an additional 150 days after the 30-day preliminary review. So you'll see at the bottom there, the full process can be 180 days, after which a decision has to be rendered. And that decision will come from the Oregon Health Authority to either, again, approve with conditions, or disapprove. So that's kind of where we are. This is a bit of a map of where we are in the timeline. Let's go to the next slide. Now, this is a text-heavy slide, so I apologize for that. But we wanted to be sure to convey the approval criteria, so it was really clear to you all what's in statute and what's in rule. So the Oregon Health Authority's analysis is really guided by the approval criteria outlined in administrative rule. For OHA to approve a transaction, the transaction must meet the criteria in A and B or C. So that's a little confusing, but it has to meet the criteria on the left side, as well as some criteria on the right side. So let me just go through it really, really quickly. The left side, A criteria, is that the transaction, there's no substantial likelihood that the transaction would have material anti-competitive effects not outweighed by benefits in increasing or maintaining services to underserved populations. The transaction would not be contrary to law. It wouldn't jeopardize the financial stability of the healthcare entity involved in the transaction, or it wouldn't otherwise be hazardous or prejudicial to consumers or the public. So to be approved, it has to meet those criteria on the left, as well as the transaction will benefit the public good and communities by either reducing the growth in patient costs or maintaining sustainable cost growth, increasing access to services in medically underserved areas, or rectifying historical and contemporary factors contributing to a lack of health equity or access to services. Or the transaction will improve health outcomes for residents of this state. So those are the statutory criteria and regulatory criteria that we look to. That's really kind of our basis. That's what the Healthcare Market Oversight Program uses when it's deciding to approve the condition or disapprove a given transaction. How about we pause there? This might be a good time to pause to see if there are other questions. And Rhonda, I'll hand it back to you to open it up.
Well, thanks, Zachary, for that thorough but yet simplified overview of the Healthcare Market Oversight Program, and specifically this transaction. Please, what clarifying questions do you have about the Healthcare Market Oversight Program in general, or this specific transition, knowing that next meeting will really dive into the transaction details? And feel free to raise your hand with the icon or to come off mute and ask the question.
I'll jump in. Can you hear me?
Yep, loud and clear.
We'll put the little heart up, but I don't know if anybody can see it.
That works. We'll take it.
So I have a couple of questions. One is, are we going to be able to ask the two organizations for more information than what we've seen already? I've read through the longer report from OHSU and Legacy, the 69-page one, but which answers some of my own initial questions, but we have others.
Yeah, great question, Howard. The short answer is yes. In fact, later in the meeting, one of the main decisions that you as a group will have to make, or will ask you to make, is whether or not you as a community review board would like to have a public hearing. At such a public hearing, that would be a time to ask additional questions and have the entities present to answer them. So the short answer is yes, you'll be able to ask additional.
Are we allowed to ask for other groups to ask their questions to us? Just not necessarily in person, I guess, but see some forum. I would imagine, for example, legacy physicians and other professional providers would have some questions. I had my own experience with becoming an OHSU provider when I was down in Salem, and some of the issues around that process.
Mhm. Yeah, there are no specific limitations for what you can or can't ask. One of the reasons why the Healthcare Market Oversight Program is so diligent at posting public comments is in part to inform the community review board members. If you're reading comments that, oh, that's a good question, yeah, I want to add that to my list of questions, that's completely fine.
And then my only other thing, I don't want to jump to hog the microphone, but the first bullet on A, are you going to help us decide whether the anti-competitive effects are outweighed or not in terms of the benefits? I mean, that seems like a pretty qualitative term. The judge.
Great question, Howard. Hold that question because we are going to deal specifically with that later in this meeting. So I'm really glad you keep that out for us. Great questions. Thank you, Howard.
Thanks, Howard, for asking those questions. I see Joseph has a hand raised.
Yes, I may be jumping ahead a little bit, but you mentioned periodic reports if this is approved and moves forward at enforcement if the OHSU is inconsistent in their actions after the approval. Is that OHA, or is there another mechanism for enforcement or discussion with OHSU with regard to, for example, shutting down services that impact equity or anything of that nature?
Great question. So the Oregon Health Authority does have enforcement mechanisms under our statute. So we do have that authority. Yeah, great question. And there are a range of mechanisms available. And that's true for all transactions, not just this one. Yeah, great question so far.
Thanks, Joe, for that question. Are there any others before we move on? Okay, there'll be plenty of opportunities to continue asking questions. And as I mentioned, in the next meeting, we'll really dive deeply more into the transaction.
Yeah, this is great.
Can we move to the next slide, please?
Let's go to the next section. Yeah, this is great. And Ron, I think this is me still to continue chatting about the community review board. So again, thank you. Melissa, let's go to the next slide. So let's start at a really high level. What is in scope versus out of scope for the community review board? Let's start with what is in scope. So first, this is a short-term group convened to discuss the OHSU-Legacy transaction. This is really a space for people from different backgrounds to share thoughts, concerns, ideas. This is a facilitated discussion. Thank you to Rhonda. With the public, these meetings are public. We have members of the public attending it right now. The meeting is recorded. The recording will be posted. And this is an advisory body to provide a recommendation to the Oregon Health Authority. What we're trying to do is create a welcoming and inclusive space for people who are not necessarily experts. I know a lot of you are, but not necessarily experts, to provide a recommendation about impacts and thoughts from their perspective and their communities. What this is not, so this isn't we're not going to talk about other transactions or other healthcare market oversight transaction reviews. This is really focused on OHSU Legacy. This isn't a formally structured committee. We don't have a bylaw. We don't have bylaws. We don't have a charter. We're not going to appoint officers or a chair. This is not a place for only healthcare insiders or professionals, right? Where this is kind of rooted in the community. We don't have formal Robert's Rules of Order processes, hearings with sworn testimony. I'll note though, if you all opt to have a public hearing, that will be different, and there will be sworn testimony, and that will be more kind of a procedural type of meeting, but that's different than our CRB, Community Review Board meetings. And this is not a decision-making body, just providing a recommendation. Okay, let's go to the next slide. So we have 4 principles here for the Community Review Board. The first is to promote transparency, and you'll notice there's a lot of overlap here with the aims of the Healthcare Market Oversight Program writ large, and that's intentional. So the first year, promoting transparency, we want to help inform members of the public and communities in Oregon about the planned transaction. That's part of the principle here. Secondly, we want to ensure that this deal, this proposed transaction, supports the statewide goals related to, again, health equity, lowering costs, increasing access, and improving quality. The principle here is to serve the community, serve the interests of the general public, including patients, other consumers of healthcare in Oregon. And lastly, to support inclusiveness. So we want to consider the diversity of Oregon communities and people's varying experiences of accessing the healthcare system across those communities. Let's go to the next slide. So let's talk a little bit about specific member expectations. So members should expect to attend all meetings, attend all public hearings, if applicable. We'll get there. You all will decide whether or not you want one. Thirdly, review the relevant material and information, of which there is a significant amount. So I first want to thank you for the time dedicated to review all that material, because it is large. It's voluminous. Next is participate in the meetings. We're hoping for a kind of active participation and discussion. And we welcome you to share your knowledge, your information, your experience, and your expertise, such that you can advise OHA. We ask that you help develop a recommendation, of course, be respectful of others, and honor the group's decisions and recommendations. Members should not discuss the transaction with representatives of the parties involved in the transaction, should not represent your own views or opinions as the views of the Community Review Board, and should not engage in personal attacks, intentionally undermining the process, or publicly criticizing or misstating positions taken by other participants in the process. We had previously posted online and sent to you all the Community Review Board Guide, which specifies that if a journalist or a member of the media contacts you to talk about the Community Review Board's process or composition or the recommendation or timeline, that you please defer and inform OHA staff, and we will respond. And then lastly, if the entities involved in this transaction tries to contact you, please let us know. Kind of generally here, speaking with entities is grounds for removal from the Community Review Board, so we want to avoid that. So just please read over these expectations of what you should and should not do. Let's go to
May
the
I
next
interject
slide.
with a quick question
Oh,
about that?
please. Yeah.
Is there someone specific at OHA that we should refer people to if we get calls from the media?
Yeah, that could be Lauren Neely or myself. You should have Lauren's email. She's the one that set up the initial orientation meeting.
Yeah, thank you.
Perfect. Thank you, Teresa. I saw another hand a second ago, but
That was me.
Howard, yeah.
Yeah, go ahead.
Have we been announced publicly yet? The members?
You have. Great question, Howard. You have. Yeah, on the Healthcare Market Oversight page, which is specific to the OHSU-Legacy transaction, we have just a 2-page document listing what is a Community Review Board, the similar content to what we just discussed these past few minutes, as well as the list of your names.
Has there been anything published yet, like in the Oregonian that you're aware of?
Not that I've seen. No, not that I've seen.
And I
Yeah,
guess, go ahead, I'm sorry.
I wouldn't, I don't know, I haven't scanned through all the attendees of this particular Zoom call, but there may be members of the media listening in now and maybe writing a story about the first meeting. That could happen. So there may be subsequent stories, which would be great because we want more folks to engage and provide public comment.
And I guess I have, Joe, I'm sure also, and I'm probably others, have friends that, professional friends that work at Legacy and OHSU.
Sure.
See, not professionally any longer, but I run with people that I know. I go to social events with other physicians.
Sure.
And I,
Sure.
and I just use this as my cover not to discuss with them.
So yeah, so we're by no means prohibiting community review board members from, you know, maintaining relationships, having friendships. Who knows? Some of your partners maybe even somehow affiliated. You know, we don't know. Well, no, we would have covered that in the conflict of interest side. So, but in terms of friendships, feel free to maintain those friendships, please. That's fine. We're not asking you to stop that. What we ask is to not discuss the transaction with those individuals. Yeah. Yeah, the goal really is that community review board processes and discussions happen at these public meetings, right? So we want to be sure that the public can engage by listening, and any kind of discussion about the transaction happens in a public forum like this. Great questions, though. Okay, I think we can go to the next slide. Great. In terms of time commitment, so we may have, you know, potentially at most up to 10 meetings. That would be a lot, to be frank. That would be a lot of meetings. So I don't think we'll have as many as 10, but we wanted to be sure, just in the event that you needed that much time and space, we wanted to be sure to set the expectation that folks could commit to that. So potentially up to 10 meetings. Potentially up to 2 public hearings if you as a group opt to have them at all. So that's going to be a discussion in a little bit here. Duration of up to 3 months at most, probably shorter than that. And plan to spend about 40 hours total as a member of the board here. Let's go to the next slide. So let's talk about timeline, kind of where we are now here in early February and where we go forward. So February 10th, obviously, today we're talking about the board purpose and orientation. Our next meeting is scheduled for next week, the 18th, during which we will do an overview of the transaction and a discussion. The following week, February 24th, we're planning for an overview of the transaction part 2, as well as additional discussion. Currently, we have penciled in a March 17th meeting for more discussion, potentially discussion about a recommendation. And if there needs to be a meeting 6 or meeting 7, we'll schedule those. So this is where we respond to the CRB, the Community Review Board. So more details to come later at that point. For the potential public hearing, again, if you wanted to have it, we did pencil in March 4th just so we could block it on folks' calendar. But actually, we just heard this date will actually be later that same week. As we adjust to community review board members' schedules that are somewhat changing. So we want to be sure as many community review board members can attend the hearing, again, if you opt to do it. So that March 4th date probably wouldn't be on March 4th, but maybe later that week if you decide to have it. So we just want to create the space such that if you do, we have it. If you don't want to have a public hearing, it's easier to take away an invitation. Okay, great. Let's go to the next slide, please. So let's talk about some responsibilities, and this is at a high level, and we can dig in a little deeper if folks have questions. So at a high level, OHA, our side, we're going to be providing the information about the transaction in a form that's accessible to all members. We will be sharing our work products from the Oregon Health Authority's analyses, provided that these do not contain confidential information. We will advise members about the Community Review Board processes and expectations, and we'll advise members on matters relating to the CRB compensation, conflicts of interest, the members' responsibilities that we're talking about now as public officials. So if you have any question about that, we're happy to provide some guidance for you. We will also support all the meetings, so we'll be doing the scheduling, all the logistics. We'll also provide other meeting support, including interpretation, translation, and other meeting accommodations as requested. We're more than happy to do that. We will be developing the agendas and the meeting materials. And then we, or namely Rhonda specifically, will facilitate the meetings. We want to be sure that this space is a safe and supportive environment where members can freely express their views. So that's it for the OHA side. Let's move on to the next slide, which is the charge of the Community Review Board. So first and foremost, it's to share input and ideas to inform the healthcare market oversight review of the transaction. So if you have stories, experiences about healthcare consolidation, access to care, cost, quality, equity, if you have any experiences about highlighting potential risks and benefits of this given transaction, identify additional data or information sources, we welcome that. We're also looking for the recommendation whether to approve the transaction. So advise us on whether OHA should approve with conditions, or disapprove. And if applicable, suggest conditions that should be applied if you all are recommending a conditional approval. This recommendation is an important product of the Community Review Board. So think of that as the ultimate deliverable of what you all are working towards. Let's go to the next slide, and let me talk a little bit about the OHA decision kind of writ large. So there are many different factors that flow into OHA's decision. One is the public comments that we receive, of which for this transaction, there are many. So just reading the public comments that we've received thus far, and they're all posted, that will take some time. So I highly recommend and ask you to read those. There's also information from the entities, including some confidential information that OHA uses for its decision, but all non-confidential information we post on the website. OHA also considers your recommendation that you're going to be putting together, as well as agency and publicly available data sources, reports, and other analyses. So all four of these things feed into the ultimate decision that will be done by OHA. Let's go to the next slide. And here is where, Howard, you had asked, how are we as a community review board going to assess anti-competitive effects versus maintaining services to underserved population? And you said that sounds like some complex analysis and maybe some quantitative analysis. So we expect the community review board to particularly inform some of these criteria, particularly the bottom one here, otherwise be hazardous or prejudicial to consumers or the public, as well as the ones on the right side. Might this transaction benefit the public good and communities by reducing the growth of costs, increasing access, rectifying historical and contemporary factors, contributing to a lack of health equity, as well as if the transaction will improve health outcomes for residents of the state. Not to say you can't provide recommendation on the other criteria, but these highlighted criteria, the ones that are not grayed out, may be will be more helpful to OHA to hear from you on. I think let's pause there because we just covered a whole lot of material. We can pause for some questions and reactions. So Rhonda, I'll hand it back to you.
Well, thank you again, Zachary, for giving such a thorough yet simplified overview of the Community Review Board. What questions do you have about what Zachary just shared? And again, feel free to hit the react button or to come off mute.
So,
oh, yeah, I see Howard. Yep.
We have some, I hope I don't have more hog the show, but as you mentioned Oregon as the geographic area, but there's clearly Legacy and OHSU both provide services in Southwest Washington, particularly Vancouver, but also they are referral centers in Southwest Washington I know for babies and mothers from other parts of Washington. So is that part of our scope of review?
Great question, Howard. Our scope is only for Oregon. So the Healthcare Market Oversight Program only has statutory authority for Oregon.
All right. Thank you, Howard. I see LJK has a hand raised.
Yeah, hi there. My name is Larry. Can you hear me?
Yes, Larry,
Okay.
are you a community review board member?
No,
Okay, I'm going to pause back to Zachary.
sure.
Yeah. Hey, Larry. Thanks so much. So so this particular meeting is really for community review board members. Obviously, it's a public hearing. I'm so glad you're watching and attending. But in terms of comments, if a member of the public, i.e., a non-community review board member, has a comment or a question, we welcome that in writing, so that we can then we'll post that and answer that. But hoping we're really designing this so it's community review board to answer all their questions for the process.
Okay.
Thank you so much.
Thank you, Zachary, for that clarification. Okay, are there any other questions about the community review board from the community review board members? Okay, this is a wonderful time to take a stretch break. It's 1:02, and if we can move the slide, please, to the next one. So it's 1:02. So if I do my math right, that means that we will come back at 1:07. So please take the 5 minutes to stretch, get a glass of water, use the restroom, and come back at 1:07. Thank you. Back from a bio break. I am going to request that community review board members, if you can turn on your screen or use one of those reaction buttons to let me know if you're back. So Joe, I see you. Thank you. I see Howard. Great. Thank you. I see Teresa. Great. I see Latoria. Wonderful. I see Leslie. So I'm just looking to see Wendy, are you with us? You could give us a call out. I see Jerry. Great, Jerry, thank you. I think Wendy's the last person. All right, well, I am gonna, since almost all of us are here, I am gonna move us forward and move us on to the next part of the agenda. If you could move yes, thank you. So what I'd like to do now is to dive into some group agreements and a decision-making process. So as a consultant, I've had the wonderful opportunity to facilitate many group meetings. And based on those experiences, I'm proposing 7 agreements for us to ensure that we work well together. Now, many of you have probably been involved in many group activities, and so you also may have some proposals, and I will welcome them after I go through my proposals. We'll then solicit feedback on any requested changes to what I'm proposing, if there is additional ones you would like to add. And then I actually am going to go around and ask for us to take a vote if we can agree that these are good agreements for us to strive for as we collaborate. So the first is to be present. I understand that many of us have very busy schedules, and sometimes we're on screen. It's easy to multitask with emails and cell phone. Just requesting that we all do our best to be as present in our 2-hour blocks of time together. If you're able to keep your camera on, that's wonderful. I do think that allows us to develop a deeper connection with one another when we can see each other's faces. I also understand that sometimes that's not possible. There's other things going on in the background. Our bandwidth isn't that good. So just keep your camera on as much that is possible or reasonable for you. Second, the idea of step up and step back. I'm sure many of you have heard of this idea. For some of us who tend to be more quiet and sit back and listen, I'm going to encourage you to step up, share your experiences, ask your questions. For those of us who perhaps speak a lot and are able to jump in quickly, kind of just notice. And if you are taking up a lot of airtime, so to speak, just step back so we can create space for everybody to be able to ask their questions and share. Third, as we've already seen, there's a lot of information to digest. There's a lot of expertise and experiences for you to share. So we're inviting us to listen as actively as we can without judgment. And to avoid interrupting when we're actively listening. If you do have, a question, try to use that chat feature or the icon with a hand so we can come back to you, but let people finish their thoughts. Fourth, let's just assume positive intent. Sometimes we use words or say things that might be a little bit disconcerting to some of us. I believe, though, that all of us are coming to this with a commitment to be of service, to make the best recommendation. So let's assume positive intent with each other. And if we do have some follow-up questions, please feel free to ask those. Next, welcome disagreement. We all have different experiences. Some of us have been very involved in healthcare and specifically with some of these entities. Other of us have had less experience with these entities or the issues at hand. We want varied perspectives. We want to hear opposing ideas. Please bring that on. That's what this forum is for. And we're just asking to bring those disagreements without being disagreeable. And what that means is to be respectful, to be kind, to be gracious with each other when we're disagreeing on content. Also proposing for us to respect the group's time. Even though we may have up to 10 meetings and each meeting is 2 hours, it will go by fast. There is a lot to dive into here. So requesting that we all keep our comments concise and to the point as possible. And lastly, for each meeting, we will share what the objective is, what the agenda is. And so we're proposing that we all strive to meet the expected outcomes of the meetings. So these are my 7 proposals for us to consider. I'd like now to step back and first ask if there is any clarifying questions that you have about any of these agreements, like you just need more information to understand what these proposals are about. I'd like to hear those questions right now. And again, feel free to come off mic or raise your hand, Leslie.
Hi, this is Leslie. I really like these group agreements, Rhonda, what you've put together. A clarifying question is on, when we assume positive intent, but there may be a misstep that happens, do we have a process or will we allow space if harm is or offensive remarks are made or someone feels harmed? Are we going to have a process on how to address that as a group?
And Leslie, thank you for that clarifying question. And I would like to hear your thought on that in terms of what might we need to consider if some unintended harm is done.
I think for me, it just is allowing the space for an apology. And it kind of goes into that, calling in or stepping back, that if there is a comment made or something that feels like a microaggression made towards an individual or to a population, that we allow space for that to call it out and call it in a safe space where apology can happen or an opportunity to learn or an opportunity to get clarification on something.
Leslie, thank you so much for that modification to this proposal. What I'm hearing you say, and I'm going to propose back to the group, is under assume positive intent. If someone does feel like there was an ouch to please raise your hand or just say ouch, and then pause for a moment to share what that ouch was about. And then if there is a process for apology, to incorporate that in. How does that sound to you? Okay, great. So we had a great clarifying question about assume intent. We just made a proposal modification to that proposal. So thank you, Leslie, for kicking us off. Want to open it back again. Are there any other clarifying questions, more information you need to understand the 7 and the 1 that we just made with the modification?
Rhonda, we had a question in the chat. If could you please elaborate on microaggression and what you mean by that?
Yeah, I'm going to ask, invite Leslie to share her definition of microaggression, if that would be okay.
Sure, just coming off mute. This is Leslie. I think for me, it's it's an assumption about a group. It might be a comment that just isn't. It's something you've maybe heard or you don't have, experience with, and so you make a blanketed statement that could be harmful to another member of the board or to a community at large. And so it doesn't always have to be an offensive remark. It can be a subtle innuendo that makes someone feel uncomfortable or is an untruth.
Thank you, Leslie. And so what I'm hearing is if you hear a statement or a comment that just feels uncomfortable to you personally, that potentially could be a microaggression. And that's the opportunity to say, ouch, and that we can pause and just work through that. Okay. All right. Feel free to ask any clarifying questions, but I'm moving on to a second question. And what changes needs to be made to any of these proposed agreements for you to feel comfortable? So the assume positive intent, we've already made a modification to that to allow for a process if someone does feel that there was a comment or a phrase that felt a little uncomfortable to say ouch, and then be able to pause and work through that a little bit. Are there any other changes or proposals to these agreements that you would like to offer right now? Okay, not seeing any hands. Anything in the chat, Lauren? Howard, I see a heart there, please. Oh, Howard, if you're speaking, you're on mute.
I just wonder, we're voting on this, but how are we making decisions? By consensus or?
We are just going to, for this round, I am going to go around and ask people to kind of do yes or no for once we get agreement. But after we get through these group agreements, we're actually going to talk about a proposed decision-making process moving forward. So thank you again, Howard, for foreshadowing what we'll be talking about next and for clarifying how we'll be making a decision right now.
I mean, wouldn't that go in this list?
Yes, I just created, for simplicity purposes, I have a couple of slides on a proposal for decision making. So it's just more of a simple division of here's kind of how proposals for our meetings and our meeting requests. And then in our next conversation right after this, I'm going to give a proposal around decision making with a couple of slides so we can really get clear about what our comfort level is with our agreed upon decision making. So it's just kind of breaking it up a little bit. Okay, any modifications to the existing proposals? Okay, my last question is, what other agreements are missing that we need to add to this list to ensure that we work well together? Okay, not seeing any raised hands, nothing in the chat. Okay, so what we have here are our 7 group agreements with a modification for the assumed positive intent, just an opportunity if someone does feel that there was uncomfortableness or some harm with a comment made, that we would have an ouch process and some pausing. So what I'm going to do now is actually go around and call on each community review board member and ask for them to say yes. And yes means, yep, I agree to these. I can agree for my intention to follow these agreements. You can also say no. And if it's a no, then just share what's holding you back so we can work through that. Okay. And again, I'm just going to go down alphabetically. That's the easiest for me just to go through. So sorry, Howard, you're the first name here. Always first. So Howard, are you a yes or no on this?
Yes.
Thank you, Howard. Jerry?
Yes.
Thank you. I do not believe Joanna has joined us yet. So I'm going to move on to Joe.
Yes.
Thank you. Latoria?
Yes, I agree.
Thank you. Leslie?
Yes.
Thank you. Teresa?
Yes.
Thank you. And Wendy?
Yes.
Okay, thank you. We can also, these aren't cut in stone as we go through our meetings. I will remind us at the beginning of each meeting just to say, hey, these are our group agreements. But if anytime some of these aren't working or we need to revisit, we can absolutely do that. But this is a good foundation to move us forward. So thank you. Let's move on to the next slide, please. Okay, and this is getting to where Howard was already asking the question about decision making. Yes, this is a type of a group agreement. And I want to go over again the proposal that I'm offering all of you, and then we'll talk more about what consensus decision making means, and then we will actually practice the process similar to what we just did. So as you all know from how Zachary eloquently shared earlier, that you all are charged with making a recommendation to the Oregon Health Authority, whether to approve, conditionally approve, or disapprove the transaction. And OHA, of course, as we saw in that lovely slide, the Community Review Board recommendation is one of those 4 components that will help Oregon Health Authority make their decision. I'm proposing that the Community Review Board use a consensus decision-making to develop its recommendation. And consensus definition is the recommendation must be one that all members can accept, support, live with, or agree not to oppose. And we're going to dig into this a little more in the next slide, but that's the general idea, that everybody can support it, accept it, live with it, or agree not to oppose. If, despite our best efforts, that this board cannot come to a consensus-based recommendation, then the recommendation will be based on majority vote. And in order for this recommendation to be made, there needs to be a quorum, and that is a majority of the board members must be present for that recommendation to be formalized. Right now, there are 8 board members. And so if I'm doing my math right, at least 5 would need to be present to have a quorum to make the recommendation. And that would mean for the majority vote, at least 5 people would have to vote for the recommendation for the majority. Joe, I see your hand up.
In the meantime, if there is not a quorum present, can the board still meet? If there's not a recommendation being made, is that?
That's a great question. I will refer it to my Oregon Health Authority partners.
Thank you, Rhonda. That is a good question, Joe. Let me get back to you on that. I want to be sure I'm answering accurately. So hold tight. I'll connect with someone and get back to you.
Okay, great. Joe, we're just waiting to hear, can we still meet as a group, right? If there is not a quorum. Great question. But we know for sure that in order to make the recommendation, we have to have a quorum on that day. Okay, can we move to the next slide? So this is a little bit more diving into what consensus decision making means, at least for our time together. As I already said, there can be a continuum of really endorsing a recommendation. One is you can think of it like, from number 5, like I am all in, like this is the best decision we could possibly make. And then you can think of the continuum going down from there where, okay, it's okay. I can live with it. I won't oppose it, right? So we're giving some latitude here for consensus making. And at kind of the end of that continuum is, I can live with it. I won't oppose it. And that would still be considered consensus-based decision making. I want to underscore, we will have full discussions with opportunity for everyone to share their perspectives. As we know, there's for sure 4 meetings scheduled. We will talk in a moment whether we want a public hearing. We know we can go up to 10 meetings. So there is opportunity for everybody to share, discuss, deliberate, and not feeling rushed or pushed to make a decision, okay? So when the group needs to make a decision, not just for the recommendation at the end, but for approving, group agreements or approving our decision-making process or whether to have a hearing, I'm going to use this process of, okay, if you agree whatever the decision or the proposal is, you can give a thumbs up, and that means, yes, I agree. You can either visually show it, or you can, my little, it's showing right there, or, come off mic and say, I agree. And typically I will go around and ask everybody's name so we don't miss anybody. Thumbs down means no, I don't agree with what the proposal is. And thumbs sideways just means I'm unsure. I need more information or discussion before I can give it a thumbs up or a thumbs down. Okay, so that's kind of the process that we will use when we are needing to make either a process decision and, of course, ultimately the final recommendation. Now, if you are giving a thumbs up or a thumbs down, feel free to give a brief rationale to the point, like a sentence or so, like I'm giving it a thumbs up because X, or I'm giving it a thumbs down because of X. That helps people understand, right, your rationale. And sometimes that rationale can help inform other people's decision making. But if someone blocks a consensus decision, gives a thumb down, I am going to ask for them to give an alternative suggestion, right? Because as a group, we want to move forward. We want to deliberate and get to a point where we can come to agreement, okay? So if there is like one person who is putting a thumbs down, we will ask that person to give an alternative. What else can we look to? And then work through it that way. I'm going to pause and ask, what clarifying questions do you have about this proposal for consensus decision making, or if you need any more clarification around a majority vote if we can't get to consensus for the final recommendation?
Is this just for that final recommendation or for other decisions?
This will be for what I'm going to call process decisions. So Howard, what we're talking about right now with the group agreements that we just went over, and for this proposed decision making, we are going to use the same process. This is also the process that we will use for the final recommendation.
Teresa, quick question. How do we decide whether to go to a majority vote or if the consensus does not appear to be working?
Yes, thank you. Great question, Teresa. So what we will do is, I want to just pause and think of the best straight line answer to this. Is let's just talk about the recommendation, because that's the most important decision that this committee will make. And let's say that we go through one round and we don't have consensus. 1 or 2 people are saying no. We hear their alternatives. So then we revise it and we go to a second proposal. And maybe one person cannot accept that. And then we go to a third. After the third, most likely is where I'm going to call a majority vote. But as with all processes, we'll see what makes sense. But I find after 3 rounds, if we can't get to consensus, that's probably pretty challenging, and that might be an indication that we need to go to majority vote. But that will be a process that we will be flexible on. Does that answer your question, Teresa?
Yeah, I was wondering if it originally sounded like you were saying that it was kind of your decision from your experience, but more flexible is also good.
Oh, absolutely. Absolutely. It really just depends how far apart we are, right? How close we are, how many meetings we've had. There's a lot of dynamics that will go into, and ultimately, of course, I would appreciate it. It's like, yeah, we can't make a consensus. And as a group, we agree to go majority vote. I mean, for sure, that would be my preference. And also knowing we do have to deliver, we have to deliver a recommendation, within the time period that we have. So those are the parameters that we'll use. Jerry, I couldn't tell if you were ready to ask a question or a comment.
No, I'm good. Thank you.
Okay.
Can I just ask one more question?
Sure.
There's 2 ways we may make the recommendation decision. From the OHS perspective, in terms of making a decision, will they be aware of how we decided? Either by consensus or by a vote, majority vote?
Yes, could we go back to the previous slide? And then I'm going to offer my Oregon Health Authority partners to comment. No, go back up. I just wanted to show that there was consensus making and majority vote. Yes, thank you. So Howard, let me first see if I'm capturing your question, and then we'll move it on to my Oregon Health Authority partners. What I believe I heard you say is that we will, as a group, describe the process by the decision making that was used. So if we use consensus based, we would clarify that. If we use majority vote, we would explain that, and we would explain perhaps the majority, what that proposal is, and then would also potentially share what the minority said in the recommendation. Is that what I heard you asking?
Well, not exactly, but that's fine. I mean, I think that's how it should be. There should be a minority report if that's how
Okay.
it's up.
Yep. So I'm good. Zachary, what's your thought on that?
Yep. So for the healthcare market oversight program, we welcome knowing not just the recommendation, but also whether it was consensus based or majority vote. Yeah. So that process is meaningful as well. I also, Rhonda, if now's an okay time to go back to Joe's question about quorum, I have a response. So if we have a meeting and a smaller number of community review board members join, but it's not a quorum, we would note that during the meeting. And the issue is we can't deliberate towards a decision without a quorum. So we would note that we do not have a quorum. We'd solicit, does anyone have any technical questions, technical issues about accessing materials online, or kind of non-substantive issues that someone is having? And then after that is done, we would close the meeting, and we would not have a meeting. So that quorum is really important.
Thanks, Zachary, for getting real-time answers to questions that are posed during the meeting. Okay, so are there any other questions or alternatives to what's being proposed here? Because after the last set of questions, I am going to move to the vote in what we were just describing. And so the proposal is that we will strive for a consensus-based decision, specifically for the recommendation, and we'll strive for that during these process decisions as well. And if we are unable, despite our best efforts to get to consensus based, we will go for a majority vote, again, specifically for the recommendation. That's the proposal. So what I would like to do now, well, I'll pause and just see if there's any final questions or clarifications that are needed. Okay, so what I'd like to do is practice this process here. So if you agree, when I call out your name, do a thumbs up. If you disagree, a thumbs down or thumb sideways, or if you just prefer to come off mic when I call your name, that is fine too. So again, and I will go alphabetically the reverse order at our next meeting. But Howard, can you give us a thumbs up, thumbs down, or some thumbs sideways?
I agree. My clinical practice of 18 physicians used a consensus-based process for making practice changes. We didn't come down to a majority vote, but that was clinical practice, which was a little different than this. So I think this is fine.
Perfect. And Howard, I appreciate how you gave your rationale for that when you shared the thumbs up. Thank you, Howard. All right, Jerry?
Thumbs up for me. I like this process. The sideways thumb I've never seen before, but it looks kind of interesting.
Something new to experiment with. Thank you, Jerry. Okay. Just checking Joanna. I don't think I've seen her. Okay. Joe? Thumbs up.
Thumbs up
Thank
works.
you.
Yes.
Perfect. Thank you. Latoria? Thumbs up. Leslie?
Yes, I agree.
Okay. Teresa? I see some thumbs. Oh, wow, look at that. That's pretty cool. She was putting multiple thumbs up there. Great. And Wendy? Great, thumbs up. Okay, so this is the process that we'll use moving forward. And if there's any questions or conversations that we need to have as we move through this decision-making process, of course, we can be flexible. All right, can we go to the next slide, please? Now, we've already heard many times that we have an option as a community review board to have a public hearing. And so Zachary is going to share a little bit of what is a public hearing, what does it look like, and then after that we'll have discussions, pros and cons, and then we will take another decision, pulse check of do we want to host a public hearing or not. So thanks for moving to the next slide, and thank you, Zachary.
Great. Thanks, Rhonda. This is Zachary speaking. So let's talk at a high level. What is a public hearing? So it's an opportunity to share information about the transaction, hear from the parties to the transaction, and hear from the public. There is a public comment period as part of a public hearing. A sample agenda may include a presentation by the entities, if you all would like that, sworn testimony from the entities. The entities would respond to questions from the board, and then public comment and public testimony thereafter. Let's go to the next slide. So just some more kind of details here. The meeting would be a virtual meeting, and the entities would show up virtually. Everyone would be virtual. If you all wanted to hold a public hearing, you would work to develop the questions over the next 2 meetings so that you have a list of questions. Then the entities would be expected to show up for the hearing. If you wanted to, you could have them present on the transaction. And then we could ask them if they would be willing to present on the transaction. And then they would answer the questions that the Community Review Board has compiled. The entities would be sworn in to answer those questions. In terms of the logistics, someone at the Oregon Health Authority would read the questions. This is for legal reasons because we are swearing the entities in to give testimony. OHA would send out a notice to local media, local officials, healthcare facilities, our internal networks. We post online, send the notice out to an email listserv we have. There are specific statutory guidelines that the Oregon Health Authority has to comply with regarding the posting of when the public hearing is happening, how to access it, etc. So we would post the announcement at least 2 weeks in advance. We are also hoping that you will help spread the word through your local networks to make sure people know about the hearing. If the Community Review Board isn't able to get through all the questions with the entities or additional questions come up, you could have up to 2 public hearings. That could be possible. You could also send a list of additional questions to the entities that they reply to in writing. So that's another option. Members of the public will be able to provide public comment during that meeting, as I mentioned, and the Oregon Health Authority would organize that public comment for anyone who would like to provide that verbal comment. If people can't attend, they can always provide public comment through email, voicemail, or the public comment form we have online. So it's a public meeting. Obviously, members of the public can provide comment during the meeting, and members of the public can provide comments after the meeting as well through multiple channels. I think that's it for the kind of high level of what is a public hearing and how it would work. Rhonda, I'll pass it back to you for other questions or thoughts that folks have.
Yeah, thanks, Zachary. Again, open it up. What questions do you have about how this public hearing may unfold, what it may entail? And again, feel free to raise your hand, come off mic.
Our comments are not the same as questions in my brain, but I mean, it would seem like the public would have questions and that we would include in the public hearing. Or they could ask them at the public hearing.
So there are, good question, Howard. There are some public comments we've received thus far that are questions, just to be really clear. They're phrased as questions, they're framed as questions. And if that question resonated with you, you could adopt it, for lack of a better term, and ask that question. For the public comment period at the public hearing, the way it's typically structured is the public comment period happens towards the end. So someone may provide a public comment that is actually a question. We welcome that. Any type of public comment is welcome. The entities may or may not respond to that specific question. Now they may opt to provide additional written response if they choose. But part of the process is the Community Review Board compiles the questions, however many you have. OHA collects them such that OHA can ask the question. And that's part of the legal aspects of swearing an individual in and then asking the question and having them answer it. So it's harder to do that when someone else is asking the question. So in terms of getting someone kind of quote on the record in that swearing in process, OHA has to be the asker of the question, but you all will create the questions over the next 2 meetings if you opt to have a public hearing. Hopefully that was a long-winded answer, but hopefully that addresses what you asked.
Thank you, Zachary. Are there other clarifying questions about the public hearing?
This is Leslie. I'm curious, can you explain when you say the entities are expected to show up on that third bullet? Can you give an example of how you define the entities? Is that legal representation? Is that CEOs? Or just share a little bit more what that means?
Yeah, great question. So representative of OHSU and representative of Legacy, they can opt to bring the CEO for previous Community Review Board process. We did have a public hearing, and it was executive staff, some of the executive staff from each of the parties. I imagine it would be somewhat similar. Although there is some flexibility there on behalf of the entities. They could send the CEO or the chief operating officer, or so there's kind of a number of folks that they would send to, they could send to represent the entity.
Thank you.
Thanks, Zachary.
So
Any other questions?
There are actually 3 entities, right? Isn't the Oregon Health Authority a third entity in this? We could ask questions publicly, or is that our job to do it in this forum?
Howard, do you mean to ask questions of the Oregon Health Authority?
Yeah, that might be of interest to the public.
Oh, sure. So for the public hearing specifically, the only entities are OHSU and Legacy. If the Community Review Board has any questions for the Oregon Health Authority about the process or the Healthcare Market Oversight Program, we can answer that at any point in time. That doesn't have to be part of the public hearing.
And that answer would be available to the public because these are transparent meetings.
Exactly.
Okay, thanks.
So this is Wendy. I'm a little bit new to the public hearing process. So a question, is the public hearing more for informing the public or for this board to receive information from the public?
I think it's both, Wendy. I think both would be achieved there. One of the benefits of a public hearing is you're hearing from the entities directly, on the record. Again, they're sworn in, and in a way that is responsive to a specific question that you have or questions that you have.
Thank you, Wendy. Great question. If there's another question, let's take it. And then I do want to move to a quick pro and cons and then a decision, just looking at the clock. So is there any other clarifying question? Okay, can we move to the next slide? So probably just a couple of minutes of discussion around pros and cons. I'd especially love to open up the mic to folks maybe who haven't had an opportunity to ask questions or share, be the first to share what they see might be some pros and cons around having a public hearing. So if you haven't had an opportunity to ask a question or share, the mic is yours right now.
I'm gonna throw some stuff out here.
That you, Jerry, here?
It's me,
Thank
Jerry,
you.
or Jerome. I think it's important to have a public hearing. Hopefully, one should be enough, but there may be questions out there to ask the entities. There's been a lot of public comments that I've read through the exhaustive list of comments and concerns from folks, entities. One of them might be in a question that we could ask in the future. I'm throwing it out there, but like long-term strategic plans for the failures or the missing pieces and parts for going out in the community. So part of this is, I look at historical information, but then I say, well, where are you going to go next week, next month, next year for some of these potential issues that come up from the public comments? So that's kind of like, I'd like to hear that from the entities.
Thank you, Jerry. Thank you for really kicking off a great summary of a pro of why you think it would be important to hold a public hearing. Again, love to hear other people's thoughts, pros of why it would be important to hold a public hearing or what might be some cons, why we shouldn't. Feel free to raise hand or go off mic, and just thank you for stating your name if you go off when you go off mute.
This is Teresa. I think one of the pros is maybe obvious, and that is that it builds trust in the community. It demonstrates to people what the plan is and what the questions are that we're asking, and shows that the work that's being done is done in good faith in the interest of the community.
Thank you, Teresa. And I see Leslie's giving a thumbs up on that. Leslie, did you want to add anything else to that?
I agree with what Teresa said, and I go back to kind of what the earlier slide said about what the aim is of this group, this program, and one of them is to promote transparency. And so I think by giving that opportunity for folks to hear directly, does that. I'll add in a con to that is I think it's going to require more work on us as a committee, that we are going to have to come up with very intentional questions that we want to have represented at a public hearing. And so it will be maybe a little additional work for us, perhaps.
Thanks, Leslie, for sharing that pro and the con. Love to hear if there's other similar pros, different pros, or cons as well. Howard?
I think along with the community having trust that this is going to be good, and that they're doing they're going to do what they say they're going to do, is that I think it has to be trust on the professional side. The providers, I think, need to see this happening because they're going to be merging into one provider group and one group of nurses and other professionals that work in the two organizations. And they should feel like this is a good process and well thought out. And I think the public hearing would help that.
Thank you, Howard.
This is Joe. I agree. A public hearing is definitely worth having. And my experience with the Board of Pharmacy was that when we had public hearings, we didn't dialogue with the commenters, unless there was somebody providing testimony, then there could be dialogue. But the commenters were just able to comment. And if it did delve into back and forth, that can get pretty non-constructive in some ways. So it's probably better just to listen to the comments, and if there are good questions that need to be answered, we can take those forward.
Thank you, Joe. All right, I'm opening it up for any other pros or cons maybe that we haven't heard of yet. Okay.
I have one other
Oh,
idea.
Howard, yep.
I mean, a public hearing is going to be limited in the time that would go on, I assume, a couple hours, 3 hours, whatever. There might be additional answers that could be given, written responses to the public. Would that be happening, or would they be just to us?
Thanks, Howard, for that question again. Zachary?
Yeah, I can jump in. Thanks, Howard. Good question. The answer is yes. The community review board could ask additional questions for the entities to respond to in writing.
All right, well, hearing that there was many pros shared in terms of promoting trust with communities and transparency with community and providers, and being able to ask the questions and really get clarity around some longer term strategies that might not have been so clear, that there's a lot of pros that have been shared. There was a con just requiring more time from you all and drafting thoughtful questions. I want to pause just for a moment. I know we just have 6 minutes left, but I see that Joanna has joined us. Welcome, Joanna. It's wonderful to see you. We are getting close to making a decision around whether to have a public hearing or not. So I am going to move forward with that so we can get this agreement before we end the meeting. And
Sure.
then we'll ask just for you to just do a quick hello. We won't try to put you on the spot too much, but we just want to say hello and have you introduce yourself, and then we'll talk about the next meeting. Okay, so
Excuse me, can you hear me?
yes, I can hear you.
Okay, great. All right, thanks.
And Joanna,
Okay,
you
go
don't
ahead.
need to participate in this decision since you were not, involved in viewing. So I won't call on you for this decision about whether to have a public hearing or not. So that's what we have. And what I would like to do is I'm going to start at reverse order this time. And feel free when I call your name to, again, put up a thumbs up, thumbs down, thumb sideways, or go off mute and say yes or no, or need more information. So I'm going to start with Wendy. Can you give us your vote of whether to have a public hearing or not? Thank you. Is that thumbs up? Thank you. All right. Teresa? See thumbs up. Thank you. Leslie? Thumbs up. Okay. Latoria? Right. Latoria, am I missing her thumb?
It was a thumbs up.
Thumbs up. Okay, thank you. I'm having a little. All right, Joe? Thumbs up. Okay. Jerry?
Thumbs up.
Thumbs up. Okay, and Howard? Thumbs up. Okay, so we have a consensus-based decision to hold a public hearing, and of course, my Oregon Health Authority colleagues will be getting that into place and be communicating. Is there anything else, Zachary, that needs to be said at this moment before we transition out?
Nope.
Okay, wonderful. So I know we have about 4 minutes left. I do want to welcome Joanna. Joanna, if you wouldn't mind just sharing like where you live and what motivated you to want to be on this review committee. And then at our next meeting, you'll get to meet everybody in full.
Sure, that sounds good. And I believe, is the recording going to be available? So I can
Yes,
watch
the recording will be available.
I'll make sure I've watched before next week. So yes, I'm Joanna Mott. I just want to apologize. I had an appointment out of town that was on Thursday, and I live in Klamath Falls, and you may have all heard that we had like over 2 feet of snow on 2 different days. And so I had to get everything moved to this week. So unfortunately, I had to be out of town. But I live in Klamath Falls. I'm recently retired. The reason that I don't represent an organization. The reason I wanted to, or was interested in being selected for this, was that I hoped I could bring my expertise as probably a different perspective from many of the people on the panel. I worked at Oregon Tech, and we do have some programs, allied health programs with OHSU, but I'm really here because I was a patient at Legacy, and I've been a patient at OHSU for the last 2 years. Pretty intensely. I was in the hospital for 42 days, and I've been in appointments and visits ever since, before and after. So that was one of the things, was have you been a patient? So my answer is yes, I'm representing as a patient, and from a rural area in Klamath Falls. I don't remember what else I actually put on there. I'm a microbiologist, so I have some science background. I've been involved in public health over the years. So,
well, thank you, Joanna, and I'm sorry that there was so much logistical challenges with getting the care that you need, and thank you so much for showing up and being a part of this group. I am going to move us on. I know we just have 2 minutes left. If we can go to the next slide, we'll wrap up quickly. And the next slide is just sharing about our next meeting. Hopefully you all have it on your calendar, February 18th from 12 to 2. The 2 main agenda items is going over the transaction more in detail and coming up, discussing and specifically coming up with public hearing questions, since now we know that we will be having a public hearing. Lauren will be sending, I'm sure, an email afterwards, just asking you to make sure that you've had an opportunity to review the supplemental response, as many public comments as you're able to, and the transaction notice, transaction summary, and preliminary report. Again, once she sends out that email, if you have any questions, she can help you navigate that. Lauren, anything else that we need to give a heads up about for next meeting? Okay, let's move on to the next slide. This is the Zoom link that will be sent to you. Again, if there's any questions or any support you need, you can email directly to Lauren. You can also use the HCMO info. And of course, that's the website. Next slide, please. And again, just a heartfelt thank you. This is an amazing group of people who have committed their time, their experience, and their commitment to helping to come up with a great decision. So we are so delighted that we will be partnering together, learning together, asking questions together, debating together to come up with the best recommendation to support those who receive care from these entities in Oregon. I know we're at 2 o'clock, but Zachary or Lauren, is there any other important information that needs to be conveyed as we sign off?
Nope, I think that's it. Thank you all again, and we'll see you next Tuesday.
Okay, thank you. Best wishes for a wonderful afternoon.
Thanks all.
Bye-bye.